Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to demonstrate deadlifting and how you can modify it to make it relatively easy and not too overwhelming, either before or after knee replacement surgery. I love deadlifting as an exercise overall. It really works multiple muscle groups. It's a multi-joint movement, meaning the hips are involved, your back is involved a little bit, your knees are involved, your ankles. Every body part has to contribute and work in sync for this movement. It's a great multiple muscle groups, your glutes, your hamstrings, your calves, all these muscles are working. And just a really functional, dynamic type of movement that can contribute and carry over to normal daily tasks and activities that you have to do. Now the easiest thing and what I like to do is use either dumbbells, so either one dumbbell in each hand, or you can hold one dumbbell like this in two hands at the end of it, or you can do the same thing with a kettlebell. If you don't have a dumbbell or kettlebell, just try to be creative. You can use milk jugs, you can find some heavy boxes and put maybe some books in it or something like that. Just try to be creative. So most people with a deadlift is the idea that you have this big heavy barbell of weights and you're starting on the floor and you're going whoop and trying to lift it up really high and then probably even dropping it on the floor after that, or going up and down like this. Now, getting that far down to the floor can probably be a little uncomfortable and difficult after a knee replacement or before a knee replacement. So what I would recommend is either one, you can have some sort of surface that's elevated, so a step or a small step stool to put the weights on to start from, so you're not so far down to the ground. Or what you can do is start from the top of the movement, so start from in a full extended standing position with the arms at your side or in front of you slightly, rather than starting at the bottom of the movement. So for a hip hinge, let's talk a little bit about the technique. And for this one, I'll start with the dumbbells in my hand and starting kind of at the top of the movement. So I'll go down into the position and then back up. But again, you can, if you want, start from the bottom of the movement and then lift up and down from there. So a couple things is, first you want to stand with your feet about shoulder width apart and toes either pointing straight forward or a tiny bit out to the side is perfectly okay. And you can have the dumbbells, I like to have them in front of me a little bit. You can also just have them at your side. Obviously if you have just a kettlebell or one dumbbell, you'll have it in front of you like this. But if you have two, you can kind of go in front or at the side, works well too. And what we want to focus on with this is maintaining a neutral back, neutral posture or position of the back. So we don't want to forward flex, is probably the most common thing. And we can, if you hyperextend or extend quite a bit, that's okay. It's better, I think, than forward flexing too much. But really, ideally, we want to keep relatively just a neutral position in the back throughout the movement. And how we do that is through a hip hinge. And what I mean by this is you think of your hips as the hinges on a door. So instead of curling and rounding as you go down, you're hinging at your hips. So your trunk is at the top part of the hinge, your legs are at the bottom part. And you're just going to hinge like this, up and down. Now some things to think about is your hips are going to come posterior or backwards when you hinge. So I always tell people to think of your hands like you're hitting your hands and you're almost providing that push. You're not actually pushing, but it's that cue, that input to bring your hips backward as you come down and back and down and back. Something I also like to tell people is keep your chest up. That may cause you to be a little bit more extended in the back as you come down, but that's okay. I'd rather have a little excessive extension rather than having this curled or rounded position of your back. And then I'll just show you, so with the dumbbells So for example, at your side, you're just going to come down and then back up. Or in the front, down and then back up. And I always encourage people to go as far as you feel comfortable. If you feel comfortable going all the way down to the ground and you can keep a good posture and good positioning, then go ahead and go all that way. If you feel like you can just go a little bit past your knees, then start there and just go from there and build up over time as you get more comfortable and you build your strength and build your range of motion. So that's a deadlift, essentially just kind of going up and down, focusing really on that hip hinge technique is the main important aspect of that, keeping a good position of the spine as you go up and down through the deadlift. So don't be overwhelmed when it comes to deadlifting, either before or after surgery. There's a lot of ways to modify it and make it appropriate for you and your level of your exercise and experience level. I hope you found this video insightful. Please be sure to hit that notification button and, hit that subscribe button and turn on the notifications so you can catch all our videos related to knee replacement surgery, exercises, recovery, rehab, everything else in between. Leave your comments and questions below. I'll be sure to get back to you. Thank you very much for watching.